My name is Dr. Mark Alley. I'm the medical director of the Private Harley Street Clinic, the leading private clinic in COVID-19 testing for individuals and organizations. As part of my medical training, I completed a degree in Immunology and Molecular Biology. This allows me to distill the scientific information that has been generated during this pandemic. It's really gratifying to see that the general public has really captured the imagination and is following the whole concept of what the pandemic is about, is very cognizant of immunology and molecular biology terms. It's very much a sort of a talk of the town and people at dinner parties or in the pub chatting to their friends and discussing these things. At the end of the day, true information is key in decision making, whether it be for an individual, a family, an organization or a country. It has never been as important for us all to be well informed as today. Organizations are looking for a way to get their workforce back to work. We're in lockdown. It's going to be many months before everyone is vaccinated and we can relax restrictions. So in the meantime, what can we, as an organization, a business owner, what can we do? Well, as you know, rapid antigen testing is very much in the forefront of the news today. So I'm going to look at this testing modality in some detail and tell you what my thoughts are about it. First of all, what is it and how can it help your workforce? It's a simple test based on the same principle as the pregnancy test that we've known about for so many decades, where a clear line is created in the case of a positive test. Saliva or nasal swab is obtained, mixed with a buffer, inserted into a well, and as the material traverses across a strip laterally, it generates a positive line in the case of a positive result, and therefore you get an instant result within 10 to 15 minutes. This test has to be administered by a medical professional, and that has been ordained by the MHRA, who are our regulatory body. This test has been adopted for wide-scale use by the British, German and Swiss governments, and so it's passed scientific muster. We know that it has a sensitivity up to 97.1%, specificity of 99.9%, and so therefore it compares quite favorably with PCR testing, which is the gold standard. So why is it suitable for organizations? Why should they be considering this? Well, it's accurate, it's proven, it's recognized by major European and worldwide governments. It's inexpensive, costing less than £10 per test. It's rapid. It allows for a truly pragmatic and regular testing regime. You can organize to have your entire workforce tested one morning, the results back by mid-morning, and a decision made that day, that morning, about getting your workforce back to work for a cost-effective price. If you'd like to find out more information about this, contact us at info@privateharleystreetclinic.com. I'd be happy to talk to you or your HR team about the different possibilities that exist.